is being moved. Though the contract was signed in 2008, construction started in 2014. Once the tax waiver was given in 2016, 8 years down the line, the effective date for the start of the contract was December 23rd, 2016. So that is the actual date that this contract, by the terms of the contract itself, is started. Thank you, Mr. Speaker.
To MPP Nene and a contract. The Naka, the Akan say, of course, I to cry, what now for years. When you're and Tanamica say, South Tax River and come, Nina a condition president, I was uncle when for the statute man, when you're saying, and I contracted not also 42 months, no, the complete. So granted, say all things being equal. So, or started Jumano, a timer, yeah, I want the contract, no. 2018 Kakahunia. So I think 42 months can come. We do not sign any Friday if you are bam. Former President, my parent that I could find a cover by. Now I'll be thankful and grateful to God. Say that by night the party will call join in the bar power 201 to 28. I ask about Ghana for having some bar as about bam. Yen they have a created, you have a complete Jumano, you be a maximum for in your home.
Na yenko ensemfufuro mu na yenko President Emma Chartered Institute of Bankers Ghana Right Reverend Patricia Support yenko nchen na ode atudwa say aban atimu process sia no se bibia eco digital ntino yesika kra bia nyumaku e wo my Ghana mu any National Identification Authority for asinkonwa etwato adwen ahwe kwan ahodo a wo mbefa so age Ghana card no atum e wo ye bank transactions ahodo a ebekọ so e wo ho no emu na opani e de sansem we nyina tudwa wa bro piemu ewo 25th National Banking Conference asia e course so ewo nkran program hasi
25th National Banking Conference e course yi na eti asem no asechira ne se Ghana sikasem eni bibia ekọ digital sign na bank dwumadie no so ebekọde afa mpenfo bebri ene de wonani monyam ebepiemu ewo dwumadie na ase Ghana mampanyi abedi akiri Dr. Alhaji Muhammadu Bawumia ekopiemu ewo ase Governor Edema Bank of Ghana eni mpenfo bebri ene bepiemu ewo dwumadie na ase President of that Chartered Institute of Bankers ano eni Right Reverend Patricia Support ekasai eni wochirimu se bibia ekọ digital ewo my Ghana mu no banks ahodo no ene National Identification Authority yen hyehyeye se na be na Ghana card no obehya ase edi adijuma ewo banks ahodo nyina mu.
I am very sure many banks are working with the National Identification Authority to create application programming interfaces to connect to the national database, which would assist in onboarding clients as well as the implementation of KYC, Know Your Customer requirements and reviews. With the national database in place, I believe issues of banking, fraud, as well as the risks associated with lending to clients would be mitigated considerably, thereby reducing the cost of borrowing by banks. Furthermore, deepening the digitalization in the banking industry will enhance the ability of many more individuals and businesses to access credit irrespective of their locations once they meet the necessary credit criteria required by the banks. Your Excellency, I am also aware some banks have plugged into the Ghana.gov platform, which offer a one-stop shop for the settlement and payment of statutory obligations by citizens. With the collaboration of banks, this will promote cashless economy and reduce corruption associated with the handling of cash.
Yetwaswana yeko Ministry of Gender, Children and Social Protection aswe ene da wiase nyina etuesi wo erehye eye fa ediama wiase nyina enkwala na oba omai Ghana ma enkwala e wo parliament ho a ene enso de to omai Ghana mpanifo anim chese covid aba ene eye wiase nyina wiemu babere a esesa no mpanifo hwe se na be ya enkwala enkofo ha obi emfamre omo.
This issue to be discussed is the effects of climate change on children, and the floor is open for discussion.
Madam Speaker and the House, as you are aware, we in the minority have always debated actively on the floor of this House. As a caucus, we do believe that COVID-19 has a grievous impact on the lives of children. So therefore, Madam Speaker, I second the motion that impact of COVID-19 and climate change should be a topic of discussion.
National Children's Parliament Jumedi Okosi na ye pani behwe emofra asinkunya etoato adwen sane amrahye bedwafo ye ne pepepe ohawa amofra fam ne titiriwu ene samre a COVID-19 abesensen amansan komi na sa dwumadi ya asoso no na asakwa akoye fa hye ampenifo ehwe ede akakai World Children's Day ye hwe sane amofra no na wosi etoato adwen edefa.
Ghanaians have a habit of burning their rubbish, and this leads to the change in the atmosphere and global warming. These practices pollute the air and damage the ozone layer that allows the sun to give us skin diseases. I suggest that the country should have a free rubbish collection and recycling scheme.
These days, a few schools have access to professional counselors to help kids who are dealing with mental issues. To solve this problem, I would like to urge the government to post professional mental health workers at each and every school in both rural and urban areas.
Madam Speaker, we shouldn't forget that not all children can climb the ladder of education. Some have physical talent, and the government should allow the schools to have their normal sport activities. This will help the children to stay in schools and also enjoy going to school. Thank you, Madam Speaker, once again.
Kwanchira for penina wa so ye hwem mema ene mofra yedie so Dr. Afisa Zakaria ekasa ni wochirim se enkoma mofra ni di no emeye mfa ne se eye nkwalasem enyansa wo mu pa emudo nyinyina mu no aban ebete no wasopam na aban so te a anamom bia wo so wotu edefa ho no obeye ne sa.
Education now we have free SHS, so from primary once you are able to enter school, then you can move up to SHS level without having to burden your parents or caretakers on financial issues much. And then those in kindergarten and primary, you know, our ministry will provide hot meals for them. At least they get one hot meal a day. Government has also provided computers and other digital devices so that the children can learn. But we're going to capture whatever they come out here with. There will always be improvement. Every year we come with innovative ways of doing things and improvement in areas that they highlight.
Na yenko nsem fufuro mu bio na yenko pani a wo hwa apomde hu nsem so ema enkran pumpuni mantam no mu eye Dr. Charity Sapon yenko ne nchen odi afutuo ama apemfo sese wo mu ehunu se wo mu nyima entempa no ano wo mu nko antenatal se de beya ebetimi abo mu na ohaw bia entimi emma wo manyim sen no mu ni titiw se ebeya wo mu bewo abra eye bosome nkron no enso ye ya akoto kasam ye beka ne se premature birth no entumi ensi no pani e de sa afutuo etudwa wa abra Greater Accra Regional Hospital wo mu eyi da esi ho a wo mu didi 2021 prematurity day. Ghana Health Service for Hremu afibia no enkwada ye wo mu abra wo mu bosome nkron no enso ye no eye 128,000 emu no be te se 8,400 de wo mu enya emfie num na wo mu firi atiasefo nsase so ise dodo no enya complications wa abra na wo mu enyini enu ti potoka sam no ye kan se wo mu ye premature baby na eno na ye apumdi mpanimfo a wo mu wo my Ghana mu ya wo mu wo eye Greater Accra Regional Hospital wo mu ayi daba kon si ho a wo mu ede year 2021 prematurity day ya omude efa so ema adisua asan abodawuru afa premature babies ho eno nam so ama Greater Accra Regional Director ema Ghana Health Service Dr. Charity Sapon ede atodwa se ehu behia se wo bebodawuru afa premature babies ho se de beya wuwu bia wahunu kwan ahodo abefa so atete wo mu nyina
sese so abanda Roma krampo yesese wo fa furu na wo ba hospital ye fa bibi free maternal health package no untri ahwe enti fiti bra first day a wo hu se wa fa furu no
ma wo nan nye ntiatia wa yare sabia bra ye be show ye be hu yare wo wu mu kra sampo na afuru ne pue ni yetimi aboa wo sane ye wo se ye boa wo saa na bibia kwa wano me ye ntena fie ni ankase ye we ye senti besumi ko bra ye we nimdie no sabe ni ye no nyina bebom ai she akola no kosi time obewo afa ho afa akola no bantam a ye be koso aboa ama akola no so agina aye.
Medical Director Emma Greater Accra Regional Hospital Dr. Emmanuel Srofenyo enso editu dwa interventions ahodo a wo mu edi agu fom ebeboa premature babies a ye wo mu e wo man yi mu.
Managing premature baby goes beyond the gadgets. There are other important parts, other important things that we need to do, and one of the critical ones is making sure that the baby is always united with the mother. But with the impact of COVID, we had a situation where sometimes the mothers themselves are even afraid of the hospital. It came to a time people thought that, oh, the COVID is in the hospital. And so people were even shying away. Antenatal clinics, people were even shying away. And that is why the COVID had an impact on the premature, on the incidence. Because people will stay at home until the baby is about to come. And then they rush. Some of them, if they had come earlier, we could have given them medications to prevent the condition, or at least to make sure that the baby mature a bit more.
Observe baby adu ye twa ho aba ye ba betrase na twetwe nkomo afa yi levia eba no ehun nkomo twetwe eni kwa ye befa so abo oman no eni oman ma no so kwa ya befa so atumi ade aboa etwe ho ba ye betrase si hu enkonwa